Good afternoon. Thank you for having me today. I'm going to present our research plan on evaluating the effectiveness of hydroponic vegetable gardening on improving quality of life in cancer patients and their caregivers. My name is Dr. Taehyun, and I'm an assistant professor at Texas A&M School of Public Health. Since diagnosis, cancer patients experience high mental distress across the cancer trajectory. Many factors affect the development of psychological distress among cancer patients. A recent study showed the significantly higher prevalence and severe anxiety and depression in cancer patients compared with healthy controls. And their mental health is highly related to their pain perception and quality of life. Then what about their family caregivers? They spend excessive hours in caregiving, and half of them have serious psychological issue. And this leads to even high risk of physiological diseases. Therefore, it is important to develop intervention strategies to reduce psychological stress and improve their quality of life in both cancer patients and their caregivers. The regular contact with nature can promote health. Gardening provides substantial health benefits, including reduction in depression and pain medication use, and increased self-esteem and mood. Especially, the vegetable gardening increases the consumption of healthier diets and make patients experience hopeful and nurturing feelings and a sense of achievement. However, there are some challenges with traditional gardening. It is difficult to do in the urban setting without yards, and it is climate and weather dependent if we think about the scorching summer and freezing winter. And it has risks from surrounding variables. There is also an accessibility issue in people in wheelchair or who cannot kneel or bend easily. Some suggested the healing garden or community garden, but it may not be available in many areas. And those activities can be restricted under certain situations, such as COVID-19 pandemic requiring social distancing. The indoor hydroponic gardening system is a solution for those challenges. This is soilless, and soluble nutrients are provided directly to the roots in the water. And it is not affected by geological conditions such as arid environment, weeds, and insects, leading to no toxic chemical use. And it can also provide accessible gardening experience to all kinds of people. And the size of this system is small, and a little indoor area, even at the corner of a table, is enough. This is the first study to examine the feasibility of the indoor hydroponic vegetable gardening as intervention strategy to improve mental health and quality of life in cancer patients and their caregivers. We will conduct a single-arm intervention study with 25 pairs of cancer patients and caregivers recruited at the Houston Methodist Cancer Center, and they will grow vegetables at home for 12 weeks with AeroGarden hydroponic system. Outcomes will be evaluated at baseline, 6 weeks, and 12 week. Depression, quality of life, fruit and vegetable intake, and pain management will be assessed using surveys. And the serum cortisol will be measured in the blood, which is a biomarker for stress. An open-ended questionnaire will be used to assess their experience and feelings. This study will provide evidence whether the indoor hydroponic gardening system can be integrated with cancer treatment to manage mental health and quality of life. In addition, our findings can also promote daily contact with nature in general people who could not participate in conventional gardening. We established a multidisciplinary research team, and I want to express my appreciation to our research team members. Thank you for your attention.